Welcome to the DSP New Hire Orientation, Faith Medical Services. Before we get started, the information that will be shared in this video is very important for us to succeed as a team. We ask that you put away your cell phones or any items that may cause a distraction. Thank you. Welcome to Faith Medical Services. This orientation was developed to provide you detailed information about our company, as well as to understand our policies and procedures. If you have questions or concerns about the policies, please discuss it with your care coordinator after this video. The policies stated in this handbook are subject to change at any time at the sole discretion of Faith Medical Services. From time to time, you may receive updated information regarding any changes in policies. Thank you. About us. Faith Medical Services is a private home care agency providing excellent services, skilled and non-skilled nursing in Georgia with over 10 years of experience. We are Georgia state licensed, insured, and an active member of Georgia Association of Community Care Provider, GACCP, faithfully serving over 50 counties in Georgia. We're committed to providing quality, timely, value-driven healthcare to all we serve. We are a drug-free workplace. Office info. Our office is open Monday to Friday from 9 a.m. to 5 p.m. Our after-hours answering service is available for emergency contact at 770-907-7226, 24 hours a day. Mission and core values. Our vision: to be a preferred provider in home healthcare industry. Our mission: we achieve our goals by providing our clients with quality, timely, and value-driven services with high integrity that respects individual needs and uniqueness. Our core values: diversified and specialized services, on-site visitation. We provide ongoing staff training, prompt response with excellent customer service, 24-hour on-call emergency contact, experience, and professional team. Job description: direct support staff support individuals with disabilities in community-based residential homes and family support services. Direct support staff assists individuals with daily living skills development, health and wellness management, medication administration, proxy caregiver only, behavioral and communication development, and personal cares. Note, as a DSP, you are not allowed to and cannot administer medications. Quality support services will be delivered with dignity and respect for each individual's unique needs. Direct support staff advocate for individuals to be fully integrated into community life. Essential job functions. 1. Implement each person's individual daily program plan, person-centered notes ISP goal tracking. 2. Follows abuse prevention plan as written for each person. 3. Follows health plans as written for each person. 4. Completes work duties as assigned. High performance objectives: communication, accountability, proactive, team player. Non-compliance policy: ethical practices. No employee may take a client from our company or work a client after a termination from us for 1 year and within a 20-mile radius, nor compete with, solicit service, or utilize clients, and shall not own, manage, operate, or control directly or indirectly any business similar to that of the owner. Violators will be penalized. Code of Ethics: Customer Service. Customer Service. Customer service is serving your customers' needs and expectations from your business. Customer service is simply expressing common courtesy and caring attitude towards your customers. Customer service requires a great team commitment to meet and exceed your customers' expectations. Customer service is making the person feel valued and always remember the company mission statement. Code of Ethics: Customer Service. Not acceptable to use the client's car for personal reasons, consume the client's food or beverage, use the client's telephone for personal calls, discuss political, religious beliefs, or personal problems with the client, accept gifts or financial gratuities, tips from the client or client's representative, sell gifts, food, or other items to or for the client, purchase items for the client unless directed in the client care plan, Bring other visitors to the client's home, children, friends, relatives, etc. Smoke in the client's home with or without permission. Report to duty under the influence of alcohol or drugs. Sleep in the client's home unless ordered in the service plan. Remain in the client's home after services have been rendered. Falsify client's records and timesheets. Not report any unusual changes or events with client during work hours. Our policies and procedures. Dress code. We expect all employees to present a neat and clean professional appearance always. Your appearance is the first impression of you. Fingernails should be active length. Your name badge is a part of your uniform and must be worn at all times. Proper shoes must be worn, no open-toe shoes. Hair should be natural color. Jewelry is to be kept down to a minimum, no large hoops. Job abandonment policy. To all Faith Medical Services employees, we greatly appreciate you and thank you for your dedication and commitment to our clients. An employee who is unable to report to work at the designated times is required to notify the care coordinator at 770-907-7226. After hours, call the same number and ask for the on-call coordinator. Zero tolerance for no-call, no-show. You must be in an extreme medical condition which would not allow you to call into work. If this is not adhered to, you will be recommended for termination. For all non-emergency callouts, we ask that you call 2 weeks in advance so that we can have coverage for the client. Remember, our client is dependent upon us. We can't care for them if we're not there. You must notify the agency at least 4 hours prior to the beginning of your scheduled shift in the event you're unable to work for emergency situations only. The office will notify you 2 hours prior to the beginning of your scheduled shift in the event that the client no longer is in need of our services. Remember that no shift is guaranteed by the client or agency. Please contact the office immediately if you arrive for a scheduled shift and find that you've been canceled. Not notifying Faith Medical Services of an absence will be considered as having voluntarily resigning as a result of job abandonment. Job attendance policy. Only one call-out will be allowed per month with documentation. If you call out due to an unplanned appointment, you must bring in documentation of your absence, but must notify us in a timely manner. Employees who fail to report to work upon accepting an assignment will be penalized and recommended for poor work ethics. If policies are not adhered to, disciplinary actions will be taken up to termination of the employee. Employees with excessive callouts will be removed from the client's home and assignment. If you quit an assignment without proper notification, 2 weeks' notice, or call out more than once a month, your pay will be decreased to the current minimum wage. You need to know about our attendance tracker here at Faith Medical Services. We use an occurrence system, and listen on to know how it works. Occurrences. Each time an employee has an unscheduled absence or fails to report to work, it will result in 1 occurrence. 5 occurrences are considered excessive. Once an employee has reached 5 occurrences, the employee will be called in for a meeting to discuss the occurrences and how we as an employer can help. During this review, if you have any documentation about previous absences, you can bring it in, and at management discretion, occurrences may be removed. An absence that spans over multiple days for the same reason will be counted as 1 occurrence. Lateness. 2 late clock-ins will result in 1 occurrence. Excuses with no occurrence, jury duty with documentation, childbirth, car accident, military duty, bereavement with obituary, explanations at the supervisor's discretions. Note: over 5 occurrences is ground for removal from your assignment. In a rolling 6-month period, the oldest occurrence will roll off. Long-Term Abuse Act. Abuse means any intentional or grossly negligent act or series of acts, or intentional or grossly negligent omission to act, which causes injury to a participant, including but not limited to assault or battery, failure to a participant, including but not limited to assault or battery, failure to provide treatment or care, or sexual harassment of the participant. Exploitation means an unjust or improper use of another person or the person's property through undue influence, coercion, harassment, duress, deception, false representation, false pretense, or other similar means for one's own profit or advantage. Participant means any person receiving services from the agency. Please refer to the handout for further information. Critical incident reporting. Critical incident: any event that involves an immediate threat to the care, health, or safety of any individual in community residential services, in community crisis home services while on site or in the care of a provider, in the company of a provider's staff, employee, contractor, or enrolled in participant-directed services. Critical incidents that must be reported to DBHDD are listed in Attachment A. Critical Incident Database. DBHDD web-based system for entering data about critical incidents, known as Reporting of Critical Incidents, ROIC. Critical Incident Report. A report made of a critical incident that provides information regarding the incident, including a thorough description of the incident. Individual. For the purposes of this policy, the term individual is used to refer to any person in receipt of mental health, addictive diseases, and/or developmental disabilities services that are financially supported in whole or in part by funds authorized by DBHDD. Individual is the term currently used in place of consumer. Infection control procedures. Use universal precautions at all times while working in the client's home. These precautions are no different than what you have already learned while working in a hospital or nursing home setting. Always wash your hands before preparing food or after loading the washer. Remember to wear gloves and wash your hands afterwards when cleaning, assisting a client with personal care, changing linens, or diaper. Gloves should be worn, we supply you gloves, and the area decontaminated according to institutional policy. If not specified, a freshly made solution of 1 part chlorine bleach to 9 parts water can be used. Emergency procedures. In cases of all serious emergencies, falls, unconsciousness, and everything that looks like it, ensure the client is safe. Call 911 immediately for all life-threatening issues. Report incidents to the office immediately. Make an incidents report and send to the office ASAP. Whenever you have any situation, client refused bath, bruises or sores, changes in client conditions with your client, these are the procedures to follow. Ensure the client is safe. Call family member, look on your care plan for client's representative contacts. Call and notify the office immediately. Make reports on your progress notes or incidents report forms and send to the office as soon as possible. You must also report the following to the office immediately: client hospitalized, client out of home, all client complaints about their health status, client refused services. P.S. If the incidents happened when you were not on assignment but was brought to your attention, it must still be reported. Client's rights and responsibilities. Grievance, HIPAA. Client's rights and responsibilities. Right of access to accurate and easy-to-understand information. Right to be treated with respect and to maintain one's dignity and individuality. Right to voice grievances and complaints regarding treatment or care that is furnished or not furnished without fear of retaliation, discrimination, coercion, or reprisal. Right to a choice of approved service providers. Right to accept or refuse services. Right to be informed of the complaint procedures and the right to submit complaints without fear of discrimination or retaliation, and to have them investigated by the provider within a reasonable period of time. Right of confidentiality of all information and client records. Right to be informed of and participate in preparing care plan and any changes in the plan. Client's rights and responsibilities. Right to be advised that the client and the responsible party, if applicable, must advise the provider of any changes in the client's condition or any events that affect the client's service needs. Right to be informed of the name, business telephone numbers, and business address of the person overseeing the services and how to contact that person. Right to be advised in advance of providers who will furnish care and the frequency and duration of visits ordered. Right to have property and residence treated with respect. Right to be fully and promptly informed of any cost share liability, and the consequences if any cost share is not paid. Right to review members' records on request. Right to receive adequate and appropriate services without discrimination. Right to be free from mental, verbal, sexual, and physical abuse, neglect, exploitation, isolation, corporal or unusual punishment, including interference with daily functions of living. Procedure for filing grievance. An individual is free to file a grievance at any given time. When an individual, legal guardian, or family member files a grievance with Faith Medical Services, the following steps below are implemented. An individual may bypass FMS procedures at any time during the grievance process and contact the Office of External Affairs at 404-657-5964. The director will meet with the individual, legal guardian, or family member and anyone involved within 24 hours to discuss the issue. The director will work with the individual, legal guardian, or family member to reach a mutually beneficial solution that is satisfactory to the individual. The director shall report back within 5 business days. Further steps to filing a grievance. If an individual is not satisfied with the outcome of the grievance or complaint, the individual or responsible party may contact the Department of Behavior and Developmental Disabilities Office of External Affairs. Office of External Affairs. Phone 404-657-5964. Fax 770-408-5493. Email dbhdd.constituent services@dhr.state.ga.us. HIPAA policy. The Healthcare Insurance Portability and Accountability Act of 1996 was enacted by the United States Congress and signed by President Bill Clinton in 1996. Faith Medical Services recognize that employees may have an emergency call which they need to receive or place. In all cases, personal calls should be minimal, whether the calls are placed or received. Therefore, abuse is subject to disciplinary action following normal company procedures. Do not discuss the client and their affairs with anyone. HIPAA law. Do not discuss your personal issues as well as the company's issues and affairs in the client's home. Be professional always. Dual diagnosis. What you should know about dual diagnosis. Dual diagnosis, also referred to as co-occurring disorders, is a term for when someone experiences a mental illness and a substance use disorder simultaneously. Either disorder, substance use, or mental illness can develop first. People experiencing a mental health condition may turn to alcohol or other drugs as a form of self-medication to improve the mental health symptoms they experience. Symptoms. Because many combinations of dual diagnosis can occur, the symptoms vary widely. Symptoms of substance use disorder may include withdrawal from friends and family, sudden changes in behavior, using substances under dangerous conditions, engaging in risky behaviors, loss of control over use of substances, developing a high tolerance and withdrawal symptoms, feeling like you need a drug to be able to function. Symptoms of a mental health condition can also vary greatly. Warning signs, such as extreme mood changes, confused thinking or problems concentrating, avoiding friends and social activities, and thoughts of suicide, may be reason to seek help. How is it treated? Detoxification, inpatient rehabilitation, supportive housing, medications, self-help and support groups, double trouble in recovery. Purpose, scope, documentation. Purpose and scope of services and care. Choices define quality of life for individuals with intellectual and/or developmental disabilities. Support in doing activities of their choice, spending time with people of their choice, and doing work of their choice that they enjoy can empower these individuals more than sheltered programs which provide limited options for social engagement and employment. Individuals with IDDs have said they want opportunities where they can do meaningful work, show their talents, and interact with others that are at the same level as themselves throughout their community. The goal is to serve the individuals without compromising their daily living standards. This is where you come in. Person-centered documentation goals. training provided on the goal, objective, task, supports, prompts, coaching given by staff, how the person responded, what parts of task were achieved, progress made, not made, and the measure used to determine this, justify whether progress was made or not, anything you might do differently next time, and any next steps. Do's and don'ts. Do's: coaching provided, person's response, learned new. Don'ts: only staff actions, not matching objective, no progress or lack of progress. Which note is person-centered? Objective: Charlie will develop a shopping list when he goes grocery shopping. Charlie wrote down the shopping list and asked staff to assist him on the list. Charlie did a good job on this goal. In making his shopping list, Charlie remembered all of the desserts he wanted, but needed to be reminded about his favorite things he likes to eat for breakfast, lunch, and dinner. He showed progress because he remembered to include toilet paper and paper towels, which he always forgets. Next time, I will prompt Charlie to start with breakfast, lunch, and dinner. Which note is person-centered? Objective: Sam will take part in an athletic activity of his choice for 15 minutes, exercises such as stationary bicycle, walking on the track, walking on the treadmill. Sam completed his goal with verbal prompting. Today, Sam chose to walk on the track and did so for 12 minutes. Staff reminded him he was only 1 minute away from his best performance, and Sam walked 1 more minute. When staff cheered for his new record, he high-fived the staff and left the track laughing. Health tracking. What is tracking? Tracking is monitoring the care and services of the individual served. A. HRST tracking. B. ISP goal tracking. C. Community integration log. D. Behavior tracking. If applicable, PICA, aggression, property destruction, food seeking, self-injury, SOB, elopement, unsafe behaviors, etc. E. MAR tracking, only if applicable. F. Seizure tracking, if applicable. G. HBP tracking, if applicable. H. Constipation tracking, if applicable. I. Skin integrity, if applicable. J. Fall tracking, unsteady gait, HX of falls, if applicable. Health tracking. Tracking specific to the individual and your coordinator will train you accordingly. An example of tracking: seizure tracking. Each day you work, you will track on the log if he/she had one or not by writing S for seizure and NS for no seizure. In the event he or she has one, you will provide a brief detail of the event and the result on a form attached to the seizure tracking log. Tips for improving your progress notes. Tips: ensure statements of progress or lack of progress are backed up with how you know that. Do your notes beg any questions? Are there gaps in information? Write the notes with the person. Sit after the session and ask the person what progress was made or what changes are needed to provide better supports. Make sure the data is accurate and reflects the measure. Critique each other's work across homes and sites to learn from each other and to build on each other's strengths. Trade notes with a coworker. Use peer mentors who write great notes. Evaluate your organization's format being used to document on-goal and objectives to ensure there is a means to document person-centered details. Use prompts and questions in the documentation template to help remind staff of what should be documented. Key areas to remember: coaching, response, progress. Cybersecurity, telehealth. What is cybersecurity? Cybersecurity is the practice of protecting systems, networks, and programs from digital attacks. These cyber attacks are usually aimed at accessing, changing, or destroying sensitive information, extorting money from users, or interrupting normal business processes. Implementing effective cybersecurity measures is particularly challenging today because there are more devices than people, and attackers are becoming more innovative. Cisco. What are the main cyber safety and security threats? Inappropriate material, cyberbullying, online predators, sharing personal information, email, instant messaging and chat rooms, cell phones and Wi-Fi gadgets, social network sites, online gaming. Top 8 tips to ensure your telehealth system is secure. When it comes to telehealth, taking a proactive approach to security can greatly minimize risks to protected health information, PHI, and HIPAA-protected data. Here are 8 top tips organizations can follow to maximize security in their telehealth systems. Encrypt all mobile devices used to capture and update PHI. Encourage use of two-factor authentication for EHR database access. Always positively identify patients before beginning telehealth encounters. Update computer operating systems and relevant applications as prompted. Educate patients on security best practices through videos posted on your website or sent via email. Consider installing a VPN if your organization uses a wireless router and your providers conduct televisits from home. Use a telehealth platform compliant with HIPAA and PHI policies. EHRs with integrated telehealth programs that have been certified by the Federal Health IT Governance are compliant. Regularly review and update security policies in place for all personnel and contractors who work with smart medical touchpoints, including online patient portals, smart home devices, fitness devices, and more. Handling of licit and illicit drugs. Key definitions: licit drugs, legal substances like prescribed medications; illicit drugs, illegal substances or misuse of legal drugs. Protocols, confiscation, and reporting. Confiscation: secure any unauthorized substances immediately. Place in a secure area inaccessible to clients. Reporting: notify your supervisor immediately. Document details, date, time, description, and actions taken. Protocols, documentation, and education. Caregivers' responsibilities. Act promptly and professionally. Follow protocols and report incidents. Participate in ongoing training. Documentation. Complete a detailed incident report. Include photos if permitted. Ensure confidentiality. Scenarios for practice. Scenario 1. A client brings in an unlisted controlled substance. Actions: confiscate, report, document, educate. Scenario 2. Visitor leaves illicit substance in a common area. Actions: secure area, notify supervisor, document incident. Conclusion: maintaining safety is a shared responsibility. Follow protocols and report uncertainties immediately. Ensure compliance for a safe environment. Payroll credentials. Pay period, payday. Time will be submitted daily through our mobile clock-in system daily. We pay bi-weekly on Fridays. Please refer to the payroll sheet in your orientation packet. We only do direct deposit, no paper checks. We have a no checks pickup policy. This rule has minimized errors in employees' pay. To receive a direct deposit, fill the required form and attach a voided check or bank letter. We offer pay cards at no cost to you if needed. No exceptions. Direct deposits take at least 2 or more pay cycles before it becomes active, depending on your bank. The pay period begins Sunday and it ends Saturday. The first 90 days of employment will be a probationary period. Important note on credentials update and in-service trainings. All certifications must and will be updated in a timely manner, no exceptions. 16 hours training within 60 days of hire. TB tests, renewable every year and every 10 years for chest x-rays. Letters will be sent out at the beginning of the month, as well as phone calls being made to ensure the certifications are updated in a timely manner or be removed from your assignment. In-service training log. Your coordinator will discuss with you on taking necessary training on Relias within 90 days of employment. See your folder with training log. Cogent. DBHDD strives to protect the health and safety of all individuals served and safeguard state property. DBHDD policy requires that reasonable efforts be made to provide safe and secure environments for individuals staff, and any other work-related contacts. Based on this objective, any person who is under contract to provide services for DBHDD must undergo a fingerprint-based criminal history record check. Additionally, all employees of contractors and anyone contracting to perform direct care, treatment, custodial responsibilities, or any combination thereof must also undergo a fingerprint-based criminal history record check. DBHDD recognizes EEOC guidance that exclusionary employment policies should be job-related and consistent with business necessity to avoid potential disparate impact on race and national origin. For these reasons, DBHDD conducts criminal background checks targeted to consider the following factors: the nature and gravity of the offense, the amount of time elapsed since the date of offense, and the nature of the position being sought in relation to the offense. CPI Crisis Intervention. Crisis intervention teaches how to stay calm, manage your own response, set limits, handle challenging questions, prevent a physical confrontation. Critical incident reporting. A critical incident is any event that involves an immediate threat to the care, health, or safety of any individual. These include 1. Hospital admissions, 2. ER visits, 3. Aggressive behaviors, 4. Falls, 5. Anything you feel as though is out of the norm for the client and their environment. As healthcare workers, we are mandatory reporters. Our clients must always be given humane care and treatment and are treated with kindness, dignity, and respect. How to report: verbally, in person, or over the phone. Quietly, send an email, Alea Care messaging, or texts. Who to report to: your direct supervisor, anyone at Faith Medical Services, client caseworker, client family member, authorities. Workplace violence. Workplace violence, WPV, is any act or threat of physical violence, harassment, intimidation, or other disruptive behavior that occurs at the work site. It can affect and involve workers, clients, customers, and visitors. In-home healthcare, WPV is defined as any work-related aggression or challenge to workers' safety, health, or well-being. It can include verbal abuse, physical assault, sexual harassment, bullying, and incivility. Violence against care workers is common in the home setting and can affect the physical, mental, and emotional health of both workers and care recipients. Some examples of violence against care workers include yelling, using abusive words, making racial slurs, verbal threats of harm, pushing, scratching, pinching, slapping, punching, throwing bodily fluids, etc. What is 988? The 988 Lifeline provides 24/7 free and confidential support for people in distress, prevention and crisis resources for you or your loved ones, and best practices for professionals in the United States. This hotline is focused on addressing those in mental health crisis. Callers will be connected to a trained staff member who can help address immediate needs and connect the callers to care resources 24 hours a day, 7 days a week, 365 days a year. How to use 988. 988 Lifeline Chat and Text connects you with caring crisis counselors for emotional support for free. Your conversations are free and confidential. You can text 988 to begin a conversation. You can call 988 to begin a conversation. You can go to 988lifeline.org/chat to begin a conversation. This resource can be used personally or regarding your clients. If you have a client that is showing signs of aggression, reach out to this crisis for help. A licensed professional will speak with you and tell you what you need to do and even dispatch a team to your location if needed. Where do we go from here? Glance into Faith Medical Services' future with us. Future plans. We will be increasing and diversifying our services provided as well as our client caseload. We are currently diversifying our office and field staff to accommodate for these and services we are going to provide. Career and growth. You can grow with us. Let us know if you're in school to become an LPN or RN or even medical assistant. Reach out to our retention specialist 770-907-7226 option O for job opportunities with Faith Medical Services. Our referral program. We offer a $75 referral fee for any client you refer to us. We offer $25 to $35 for each employee referral. The service must be initiated to qualify. Thank you. This concludes this portion of orientation. At this time, you may ask your orientation instructor any questions you may have. Thank you for your interest in Faith Medical Services. We look forward to a wonderful time working with you.